Smokers who kick the habit before age 45 can nearly eliminate their excess risk of dying from lung or other cancers, a new study estimates. It's well established that after smokers quit, their risk of tobacco-related cancers drops substantially over time. Researchers said the new findings underscore the power of quitting as early as possible. Among more than 400,000 Americans they followed, smokers died of cancer at 3 times the rate of non-smokers. However, smokers who managed to quit by age 45 lowered that excess risk by 87%. And if they overcame the habit by age 35, their excess risk of cancer death was erased, said Blake Thompson, a researcher at the American Cancer Society who led the study. He stressed that it's never too late to quit. Smokers who quit in their 50s to early 60s also substantially lowered their excess risk of cancer death. But the findings do underscore the power of kicking the habit as early as possible. If you're a smoker in your 30s, hopefully these findings will speak to you, Thompson said. The study was published October 21 in the journal JAMA Oncology. It looked at data on more than 410,000 Americans who entered an ongoing federal health survey between 1997 and 2014. Around 10,000 participants died of cancer during the study period. And on average, smokers were 3 times more likely to die of cancer, most often lung cancer, compared with people who'd never smoked. Much, however, depended on age, the age at which smokers both started and quit. The younger people started smoking, the greater their risk of eventually dying from cancer. Among those who started before age 18, the risk of dying from cancer was increased at least 3-fold. When people started smoking before age 10, their risk of cancer death was quadrupled versus lifelong non-smokers. It may sound surprising, Thompson noted, but there are smokers who get hooked that early in life. For people who pick up the habit at a tender age, it's imperative that they quit as soon as possible, Thompson said. That's because overall, his team estimates, smokers who quit before age 35 wiped out their excess risk of dying from cancer. Meanwhile, those who quit before age 45 slashed their excess risk by 87%. The outlook was also good for smokers who quit later. If they managed to do so between the ages of 45 and 54, their excess risk was cut by 78%, and by 56% if they quit between the ages of 55 and 64. The take-home message is that it is never too early and never too late to quit, said Dr. David Tom Cook, a volunteer spokesperson for the American Lung Association. He said doctors should help patients kick the habit as early as possible, but also never give up trying to quit. Sometimes an individual has to quit multiple times to stay off tobacco products permanently, said Cook, who is also a professor of general thoracic surgery at the University of California, Davis Health. In general, he said, smokers fare better when they get some help in the effort, whether from their doctor or through free government quit lines, which operate in every state. In a recent study, Cook and his colleagues found that participating in California's free quit line boosted quit rates among smokers seen at their clinic. That kind of support, Thompson said, can help people sort out their smoking cessation options. These include 2 prescription medications and over-the-counter nicotine replacement products, like gums and patches. Smoking raises the risk of numerous cancers, Thompson noted, including colon, kidney, bladder, stomach, and pancreatic cancer. But lung cancer is the top cancer killer among smokers. Some former smokers who've quit within the past 15 years still qualify for annual CT scans to screen for lung cancer depending on their age and how heavily they smoked in the past. I would encourage any current or former smoker to talk to their primary care provider and find out if they are eligible for lung cancer screening, Cook said. In his work with patients who have pancreatic cancer, Dr. Srinivas Gadam was bothered by something that he was seeing. There are some patients that you can't stop thinking about because they've left a mark on you and you try your best to turn things around, but there's only so much you can do, said Gadam, who said he had found himself caring for a few patients who were very young. We knew that there was a trend of younger patients in colon cancer, but we didn't know about pancreas cancer. So, I decided to see if there was a real trend. Was it just that I happened to see those few young patients disproportionate to everybody else in the field, said Gadam, who is an assistant professor of medicine in the Karsh Division of Gastroenterology and Hepatology at Cedars-Sinai Medical Center in Los Angeles. It turns out to be true. What Gadam and the other researchers noticed is that numbers of people diagnosed with pancreatic cancer, sometimes referred to as a silent killer because it's more difficult to detect in its early stages, have been growing the past 2 decades for both men and women. Even more surprisingly, they found the disease was disproportionately growing in younger women, those under age 55, and especially among those aged 15 to 34, though the sample size was small. Pancreatic cancer has typically been more common in men. If the current trend continues, researchers said pancreatic cancer among women aged 15 to 34 would grow to be 400% of that experienced by men of the same ages by 2040. This study doesn't answer why. It shines a light on the fact that it's rising, and it's rising disproportionate to that of men, Gadam said. Without knowing why, the answer for now is left open to speculation. It could be that women have a disproportionately high exposure to some environmental risk factor in recent decades that researchers don't understand yet, Gadam said. A deadly disease if not caught early. While the rates are rising more rapidly in women younger than 55, they're still very low in young individuals, according to the research, which was published online October 24 in the Journal of the American Medical Association. The research was presented simultaneously at the American College of Gastroenterology's annual meeting, which is being held both in Las Vegas and online. To study the issue, researchers gathered pancreatic cancer incidence rates per 100,000 people for 2000 to 2018 from the Surveillance Epidemiology and End Results (SEER) database, which collects data from cancer registries that cover 37% of the U.S. population. They found 283,817 cases in women and men during those years. The difficulty in diagnosing pancreatic cancer is that there is no solid screening test to identify it early, and patients don't have symptoms until quite late in the disease, Gadam said. Despite tremendous advances in cancer detection and treatment for other types of cancer, the 5-year survival rate of pancreatic cancer has improved from 3% to just 10% over the past several decades, Gadam said. Risk factors include family history. We do have a well-defined, but a small, group of high-risk patients. For those, we tend to screen annually. We tend to do MRI, CT scans and endoscopic ultrasound, Gadam explained. These are different modalities of testing on these patients to detect cancer, but for the vast majority of the general population, really not too many things to go by. Risk factors can include obesity or smoking, but they are not fairly strong predictors for pancreatic cancer, Gadam said. Doctors also look for jaundice with no abdominal pain, profound, unexplained weight loss, or a new diagnosis of diabetes. Questions remain. Obviously, not all causes of a new diagnosis of diabetes are cancer, or not everyone that has weight loss has pancreas cancer. So, we have to be really careful about that, but we look for these subtle telltale signs when we talk to our patients, Gadam said. Many people with pancreatic cancer have very vague symptoms in the beginning, such as minor abdominal discomfort or indigestion, said Dr. Sajan Nagpal, an assistant professor in the Department of Medicine at the University of Chicago. Nagpal was not involved in this study. Long-standing diabetes and chronic pancreatitis are other risk factors. By the time the cancer is detected, 80% of patients are no longer eligible for surgery, the only way to cure the cancer, Nagpal said. Other treatments include chemotherapy and radiation. The actual number of people that are successfully able to get surgery is even smaller, which is why the outcomes from pancreatic cancer remain poor, Nagpal said. It would be great if we could identify patients at an earlier stage, because that would mean patients would qualify for surgery and we could improve outcomes in these patients. Nagpal suggested more research, using larger databases and hospital-based outpatient oncology data to potentially corroborate this study and provide information about why this might be happening. Gadam also called for more research. I think this shows a potentially alarming trend and we need to put, as a society, more investment into this area to stem this rise, Gadam said. I think it calls for more research dollars, more women should be speaking out for research in this area. And I'd say if there's anybody out there that's worried about pancreas cancer in their family, or if they see a trend, they should talk to their doctor about it.